My name is Shaina Little. I go by Shay. I'm a nurse practitioner at Vado Plastic Surgery. Good morning.
Good morning.
Honestly, what motivates me the most is being a good example for both of my girls. I want them to find a career that they absolutely love, and I want them to see that through me. So typical day is we get into office at 8:30. I drink coffee, prep my charts, look at the computer, make sure everybody is coming in, map it out accordingly, and see patients all the way until around lunchtime, and then see patients up until 5:30. So my experience prior to Vado was emergency medicine. I've been a registered nurse for 12 years, and I was a registered nurse in the ED, and then decided to go into a nurse practitioner program. So overall, my background was more emergency medicine, and I always thought I wanted to do that. And then when I followed the nurse practitioner, that's when I realized I really do love the aesthetics field as well. Hey, how are you?
Thank you. How are you?
Good. I'm Shay. I'm the nurse practitioner here. How are you?
Nice to meet you. Wonderful. Thank you.
Awesome. So what's bringing you in today?
I feel like I need a little Botox, a little uplifting on my face.
Okay. Have you had it before?
I have.
Okay.
It's been about 4 months or so.
Okay. Any complications from Botox in the past? Okay. Do you know the areas of where they injected last time?
A little bit between the eyebrows, forehead, and a little around the eyes.
Okay. All right. Let's take a little look. I have worked with probably thousands of patients over the course of 12 years. If there's no trust, it's very difficult to take care of someone. I honestly think developing a good relationship with the patient is the most important. What's unique about my position is I did work in emergency medicine for so long that I've seen people at their most vulnerable be very uncomfortable, and that can be the same with aesthetics, right? Like we're discussing things that you want to change or improve or anything like that. I'm very good at making people comfortable. Okay, yeah, absolutely. So we can treat that. That's no problem. Okay. So today we're going to treat the forehead, treat the glabella between the eyebrows. Okay. We're going to treat those crow's feet, those platysmal bands, and the masseters.
Perfect. Okay. Thank you.
So, yeah. We are ultimately taking care of the patient, right? They have to have trust in a provider and that you have truly listened to what they want. This is a large industry, so there's so many different places that patients can go, and ultimately we want to be our best, and we want to provide the best care for the patients. I love my career, one, for the people that I work with. I absolutely love the people that I work with. And then also developing relationships with patients. Patients tend to become family. I love making a difference in somebody's life. And I do feel like aesthetics really does that. We want the patients to look how they feel, right? Like if they feel amazing, but they don't necessarily think that they look amazing, we want to help them on that path.